Hello, and welcome to the podcast. In the coming weeks, we'll be learning more about coronavirus. Not just about the virus itself, but of the response to the global pandemic that has shut down cities, forced people into their homes, and started a race to find effective treatments and therapeutics. We'll also utilize the knowledge of the West Virginia University community to break through the myths and mistruths about the virus, as well as understanding how old viruses are and just how they work. We'll talk to West Virginia's COVID-19 czar about how the state has responded to the crisis. We'll even explore how the West Virginia University community has shifted its gears and answered the call to help in the production of PPE, making masks, as well as helping our healthcare workers on other fronts. If you would like to follow more daily updates about coronavirus, consider following our social accounts at WVU Health on Facebook, Twitter, and Instagram. If you have a question you'd like us to help answer about the coronavirus, feel free to send us an email to wvuhealthsciences@hsc.wvu.edu, or simply send us a message on any of our social channels. You'll also find the email in the description of the podcast. Please subscribe to ensure you get the latest episodes as they're released, and leave a rating if you enjoyed the content. It can be so overwhelming at times, it can be easy to forget what we've already learned about the virus and how it behaves. For our first episode, we're talking to Dr. Lisa Costello. She's a pediatric specialist at WVU Medicine in Morgantown, and she also has a background in public health. We're having her help us give a brief refresher on coronavirus, as well as answering some other questions that we have. Since the United States began to grapple with the reality of the new coronavirus, a consistent phrasing has emerged that summarizes our response. This is war. We are at war with COVID-19. The President of the United States, Donald Trump, described himself as a wartime president. The director of the CDC called it a fight of, quote, a long war ahead. And healthcare workers have been described as serving on the front lines, battling with the disease itself. Keeping in that wartime theme, the key to any victory is to understand the enemy.
We're hearing a lot about coronavirus, and the reason it's called coronavirus is actually a large family of viruses. They usually cause mild to moderate, what we call upper respiratory tract illnesses. So basically like a common cold. Truth be told, many of us have probably had a common coronavirus at some point in our life. But there are some different viruses that can lead to more serious disease, and that's what we're seeing with the current COVID-19.
This is not the first time the United States has dealt with this particular family of viruses. In 2003, the world saw the emergence of SARS, Sudden Acute Respiratory Syndrome, a coronavirus that led to more than 8,000 cases around the world and the loss of 774 lives. The World Health Organization has long declared that outbreak contained. In 2012, the world was exposed to yet another, MERS, Middle East Respiratory Syndrome. It was responsible for 866 deaths and 2,519 cases worldwide. But MERS is still very much active. At the time of recording, we have seen millions of infections around the world, with hundreds of thousands of deaths. All three, including COVID-19, share similarities. All are believed to originate in bats, finding some intermediary to jump from animal to human. With SARS, a cat-like animal named a civet was believed to be the culprit. With MERS, close exposure to sick camels is believed to have been the cause.
There's probably hundreds of coronaviruses. Most of them actually circulate among animals, so different animals like pigs, cats, bats. But sometimes those viruses can jump to humans. That's what we call a spillover event, and then they can cause disease. So really there's about 7 different types of coronaviruses that we think cause disease in humans. So 4 tend to cause more mild to moderate disease, but then there's 3 that can cause more serious illness. And so those coronaviruses are the SARS, which we heard about back in the early 2000s, and then MERS, which was about 10 years ago, and now the current COVID-19 or SARS-CoV-2, which is this novel coronavirus that we believe started in China in December of 2019 and has spread around the world and was declared a global pandemic in March of 2020. So this disease is new. we're learning more about it, how it behaves. We're learning about its trends, and we have the history from its past brothers or cousins, if you want to refer to it as that, the SARS virus. And so we are looking at comparisons, but this is a new virus. We're learning more about it all the time from where it's been previously and now where it's been in the United States. We're learning about how to treat it, how it impacts people of all different ages. And so we do know in certain populations, this does tend to cause more severe illness than a typical coronavirus would cause.
COVID-19 is a new virus, but it shares similar symptoms as previous outbreak partners. Fever, dry cough, and body aches are all potential indicators of an infection. As always, consult with your physician. And as a note, if you believe you may have been exposed to COVID-19, call ahead to your provider before seeking care. The primary route of transmission is through droplets produced in the respiratory system. When we're sick, every time we speak, cough, laugh, sneeze, our body propels particles loaded with billions of replicated viral strains. When someone inhales those particles, or touches an infected surface and makes contact with their face, the virus takes charge. While there is still a lot to learn about COVID-19 and how it behaves, it is known that coronaviruses are incredibly fragile. Surrounding their cell is a lipid membrane, which soap breaks down, causing it to destroy the cell. That's why hand washing with soap or water for 20 seconds is so vital to stopping the spread and reducing your own risk of infection. That and hand sanitizer with 62% or more alcohol content. Unlike previous infections, COVID-19 has given us a moment to consider another potential safeguard against coronavirus: facial coverings and masks.
Really what we think the mask could do, or the face cloth covering, can help twofold. One, it may help us from stopping to touch our face so much. So for me personally, I know that this is something really hard for me. I probably touch my face more on a regular basis than I realize, and I've been very cognizant of that. I think most people would probably say the same. So if we wear a mask, it may help us from avoiding touching our face so much. The other area that we feel a mask may help, or a face cloth covering, is to help prevent the spread of disease. So what we're learning about the coronavirus or COVID-19 is that we may spread the virus before we start to have some of those common symptoms: fever, cough, shortness of breath. So by wearing a mask, we potentially may be helping to slow the spread of the virus to others, particularly those who are at higher risk of getting that really severe disease. So wearing a mask out in public, or where you're not going to be able to really maintain that physical distancing or social distancing that we talk about, really maintaining that 6 feet of separation between others, we believe wearing that face cloth covering can help slow the spread.
The CDC website has instructions available for you to make your own face covering, regardless of skill level. There's some for sewers and those who just need to make a quick covering to head outside for the weekly grocery run. What you absolutely should not do, however, is reduce the availability of important personal protective equipment from frontline workers. That includes buying disposable surgical masks, N95 masks, and other medical-grade materials. Make your covering, wash it daily with detergent, and layer up if you feel the need. It can be tempting to wear gloves in public, especially when faced with a respiratory illness that can be picked up by touching infected surfaces. But without a level of self-awareness when using them, that can spread the virus just as easily. It all comes down to touch.
We need to be cognizant of what we're touching. So if we're touching our face and then touching our phone, we need to be cleaning and disinfecting those commonly touched surfaces. We need to be cleaning our phone, we need to be cleaning the areas in which we touch, and really be limiting how much we're touching our face, whether we have a mask on or not. And when it comes to the issue of gloves, there are a role for certain individuals to wear gloves. But I think, as you observed and what I've observed, is that if you're wearing gloves and you're touching everything and you're touching your face, the gloves can become contaminated with the virus, just like our hands could be. So even if you're wearing gloves, I know this might sound silly, but you should be washing your hands still, perhaps with the alcohol-based sanitizer if you're out at the store, because the virus could still be on gloves. And when you go to remove the gloves, you need to be careful, or if you're removing your mask, because if you don't wash your hands afterwards, you could pose the risk to cross-contaminate. So if the virus was on the glove or the mask and you took it off and you didn't wash your hands, that virus could then still be on your hands. So we need to learn how to use this personal protective equipment, whether we're working in the hospital or we're going out to the grocery store. We need to make sure that we're using it appropriately and we're putting it on and taking it off the safest way possible.
All of this can look a little jarring. This is certainly not a sight we're used to. People walking around in masks, using gloves to pick up items on the shelf, slathering their hands in sanitizer like never before. This will be the new normal for a while, until we can safely develop therapeutics and a vaccine to treat and prevent COVID-19 infection. That can seem like a bleak forecast. In fact, the whole experience of retreating into our homes from enemy invasion, wearing protective equipment in the battlefield of ordinary life, can be emotionally exhausting.
We'll certainly have to continue to monitor the virus and plan for this being in our communities for a period of time. But as we've learned frequently, and it certainly can be frustrating because I think we as people all want to have the information now. We really wanted to have it yesterday, but science takes time and we want to make sure that we are studying the virus appropriately and making recommendations and determinations what we know from learning and following science and scientific development. And so time will certainly tell, but right now the plan is to prepare that this is going to be in our communities. And as we have development of a vaccine or other potential treatments that potentially could help treat COVID-19.
Even as there is talk of countries around the world, including the United States, beginning to resume a more normal way of life, it's safe to say COVID-19 will be here for a while. Outbreaks may occur, restrictions may have to be reinstated to stop the spread from affecting more vulnerable communities, like the elderly or immunocompromised. Each day, we learn more. We inch closer to effective therapies and vaccine candidates. But for the time being, we must all do our part. Keeping our own hygiene levels up, being aware of others, helping others out, and yes, even wearing masks.
I think anytime there's something new, it leads to uncertainty in all of us. We're all, as humans, a little skeptical, and many times with that comes being afraid. And I think in all of this, when we're talking about preparing for a pandemic or addressing a new disease, we need to remain calm and be as prepared as we can. And we need to take the advice of public health officials and our personal healthcare professional and what we can best do to keep ourselves safe. And so right now, when it comes to COVID-19, that's washing our hands, maintaining our physical distancing, not touching our face. Yes, people will get this disease. Some of us may have already had it and didn't know that, and we already recovered. But we can't take that risk because we don't know who potentially could get serious illness. By and large, the majority of people who get this, over 80%, will have very mild disease and will recover. And we're seeing people recover. We're even seeing people who had more serious illness, people who were intubated or had a tube down their throat to help them breathe, or were admitted to the hospital. We're seeing them recover as well. And over time, we should see more and more of that. But we also know that this can cause severe disease. So we need not to panic. We need to be prepared and do what we best can do based upon the recommendations of health officials to prepare the best we can. But by and large, the risk still is low for getting the disease. And if you do get the disease, most people will have mild illness. But we need to be cognizant of who we could spread it to, and that the other person may not be so lucky. They may have a disease that we don't even know that weakens their immune system. My mom, she has rheumatoid arthritis, so she's on medicines to weaken her immune system. You may not know that if you don't know her, but if you would go around her, if you were sick and you thought it was okay to go out and about, you could really potentially make her very, very sick. And so we need to be thinking about our neighbors in this and not just be thinking about ourselves. And I think that's an empowering thing, that you not only are helping yourself, but you had the chance to help somebody else. And I think that's the mountaineer way, that we're always trying to help our neighbors out. And so I think that we need to continue to learn and get information from reputable sources like WHO, the CDC. We need to make sure that we're getting information from reputable sources, learning about this disease as it continues to evolve, and doing all that we can with what we know can help keep us safe.